you ever think you're doing? Good evening. My name is Russell Ackaway, and you're watching Respect. Respect is a live TV talk show with young people and young adults dealing with their current and vital issues. It's young people helping young people. The panel consists of young people helping young people who are the viewers. And the show also gives youth a voice. These two areas are not to be found on any real TV show. This is a live show. Young kids are talking about their real feelings. For the sake of this show, we're deviating and decided, my co-presenter, who's my wife, Lana, and I decided to do a show on something that we're really very close to and we feel is very important, and namely, that is finding quality psychotherapy. There are many people who really need help, good quality help, and appropriate help. Those two words are very critical, quality and appropriate. Quality involves someone with very, very, very good credentials, which will describe what that entails. And appropriate means providing the exact kind of therapy that would benefit an individual. There are close to 250 different kinds of therapies. I mean, I don't need to enumerate them, but there's object relations therapy, primal therapy, behavior therapy, psychodynamic therapy, psychoanalytic psychotherapy, Gestalt therapy. How do you know as a consumer what's best for you? You just pick up the yellow pages, look in the book under psychotherapy, pick a name, maybe it's close to your house, or pick a big ad because it's more impressive. Keep in mind, you're putting your life, your mental state on the line here, which is just as important as putting your physical state online with a physical doctor, with an MD. Our field is very complicated, extremely complex. It's very ill-defined. By that I mean, if you have if you have heart problems, you go to a cardiologist. If you're a woman, to go to a gynecologist. If you're having headaches, you go to a neurologist. That's more or less simple, but the quality of those physicians is something else. As you know, there are doctors and there are doctors, and it's the same in psychotherapy, except not everyone. In fact, very few of the practitioners in psychotherapy are MDs or PhDs. MDs really have no training, direct experiential training doing psychotherapy. And psychologists do an internship. Again, they do not necessarily have direct experiential training doing psychotherapy. They may do testing, they may do short-term counseling. Neither one of these professions, psychology or psychology, are really trained in psychotherapy. Lana and I, after receiving our graduate degrees, went on for postgraduate work in psychotherapy and psychoanalysis. Another 7 years learning what psychotherapy is all about, and then setting up our practices doing psychotherapy. It's the only profession, if individual does not have postgraduate training beyond their graduate level degree, they're really not qualified to do psychotherapy. It's just a fact. But a lot of people look in the directory for a psychiatrist because that's familiar, or a psychologist, that's familiar. And I'm incensed when I watch programs like CNN or other programs where they only have MD psychiatrists or PhD psychologists talking about as authorities on a particular subject. We LCSWs have more experience, more training, more skill than all of them combined. With that, I'm going to open up talking about our first topic, a heart-to-heart checkup. And I will turn that over to my co-presenter. What's a heart-to-heart checkup? Well, you have a medical checkup once a year, right, to see how your body's doing. So what about a mental health checkup? People, did you ever think of that? The idea is, am I okay? So let's shift and ask my co-presenter to talk a little bit about the heart-to-heart checkup.
Thank you. It's good to be here, and I just want to make a fast comment in terms of LCSWs. That's a licensed clinical social worker, and he or she goes on for postgraduate training and has a variety of experiences and is trained as a social worker too. They're trained to do a myriad of problems and questions, unlike PhDs or MDs. Heart-to-heart checkup was coined several years ago by Russell and I. Sometimes one is in a life transition. A life transition could be a death in the family, a divorce, a change of career, birth of a child, eldest daughter relocating to Europe. There's a tremendous amount of anxiety and normal stress during a life transition. The adjustment period is really very difficult, shifting from doing one thing that is comfortable and familiar and going into unknown territory. Moods change, feelings change, anxiety levels go up, and it's usual and customary not to be able to balance oneself emotionally. So it would be a good idea, just as Russell was saying, for preventive care treatment in terms of a physical issue, like heart attack or a injury, to have a mental health checkup. And there, qualified people, such as Russell and I, can assess with ease whether or not the person has always had a issue going back perhaps to childhood, such as long-standing depression through neglect or abuse, or is it the transition, the injury, or the death in the family, or some other change, like a career change that is frightening the individual, and hence the anxiety has gone up. We're experienced to offer that kind of a checkup. Most people don't know about recent mood changes or noticed a change in overall health or a problem with an important relationship. Those go unsaid.
The camera. Look at the camera. Yeah, we were able to distinguish between some general major transition somebody's going through, which will be resolved at some point through maybe short-term counseling, or it gets resolved by itself. or there is some deeper problem that repeats itself. The depression is more severe, the anxiety is more severe and ongoing. Severity, and it's ongoing for months. That's a sign of a more serious issue. When to seek help? Do you want to?
Well, if the issue has not cleared itself within several weeks or months, I mean, normal grief period could be months, or even I've had patients that have come in for some grief counseling and they haven't been able to mourn and delay the mourning process for a number of years. So it depends whether or not the mood or the anxiety is interfering with your love relationships, with honesty within yourself, with your relationships, or with your work. I call it truth and love and work are the three major categories where one needs to examine their process. Russell and I differ in terms of when to seek help, more and large. I'm from the school that if it's important to change anything in your life, I've seen a lot of patients that came in as a clerical worker and they've left with a graduate degree and in a career that they're interested in rather than doing the same old thing day in and day out. So there are people that want to make a major change and they would need to seek help to get serious psychotherapy to see what's in their way. On a short-term basis, as we were saying earlier, if there is a mood change or an anxiety shift and it prevails for a number of months or years, then it's also prevalent to look at some long-term counseling rather than transitional counseling.
Yeah, but the fact is that most people are resistant to therapy. I know a lot of people who are. Therapy is for those that want it, not those that need it. There are more women in therapy than there are men because women are more oriented to talking about their feelings than men are. Men do things together. Women talk to one another about their feelings, what's going on. So how do you, and also therapy is supposedly a sign of weakness, a lack of masculinity, and I don't want to experience those feelings. I already have them. And if I go seek out they call us shrinks, but I hate the word. We're helpers. We help people. So
if you seek out an expander, then you can look at those feelings through a telescopic lens. You don't have to bear the brunt yourself. And sometimes having a catalyst to help you bear the feelings, and you're not crazy for having overwhelming feelings and anxiety, makes it easier to bear them in the long run for self. And it's true, women are much more vulnerable and yet are more courageous than men in bearing their feelings, at least some of them anyway.
That's true. Most people come into therapy when their back's up against the wall. That's not a good idea. They know they're in trouble, but yet they resist getting help. Why? Because people, basically, all people are mad and also don't want to change. Change means giving up your comfort zone, what's known, what's pleasant. There's risk in change.
People want the end result. They're not interested in the process. They're not interested in opening up and exposing themselves, because to be exposed is oftentimes for both men and women to be vulnerable. I do some consulting work, and I recently had an occasion where a man consulted me with an issue, and then a year later called me. He said he found me comfortable. I guess it's called the honeymoon phase, because eventually he's going to get rather uncomfortable. And consulted me for some deeper issue, which we're working on with some frequency during the week. I'm going to talk about how to find a qualified professional. Don't look in the yellow pages. Don't ask your friends for recommendations.
Don't see your friend's therapist.
Also, I want to put out, go shopping. I think it's really important to consult with at least 2 or 3 different people. The chemistry, as well as the credentials, are important. Somebody, as we've discussed, with postgraduate training, that has a license, that has gone for postmaster's training, and most important, that person shouldn't deflect to you and say, well, why are you asking me these questions? Don't take that from a qualified professional. Somebody that will answer the question and talk about their credentials openly, and not be afraid to say that they've went through a period of years of psychotherapy to get out their emotional issues and that are interfering with helping you. You should see someone has had the experience themselves in learning about themselves experientially, not only with their PhDs, LCSWs, MDs, and NC-PSY-A is an analytic degree.
There are many sources of psychotherapy, and they vary. Later on, when we talk about course, I'll bring this out, but there are a lot of what they call community mental health centers that are, let me go back a few steps. You can see someone privately, or you can go to a public facility. The public facilities are mostly counseling and therapy centers, basically community mental health centers that have MDs, psychologists, clinical social workers working for them. I was clinical director of a very large outpatient psychotherapy center in Forest Hills. And I had 28 therapists working for me and 4 psychiatrists I managed. And going to a community mental health clinic does not guarantee quality of training. Yes?
I have a question.
Okay. Well, what's your name?
This is Eric.
Hi, Eric.
I have a question about, mental health and, actually dealing with a therapist. How does one learn to gain that trust from this person? This is a stranger, somebody that I don't know. How do I, accept myself and open up to them and actually tell them everything that I need to tell them in order to, get better? How can one learn to do that? Do you have any pointers, tips on how one could do that?
Are you someone who doesn't trust in general, or?
I guess so. It takes me a while to, open up to people, individuals, especially if I don't know them. So, yeah, I guess you could say that.
Do you have friends you've opened up to?
Yeah, but it takes me, a real long time to actually open up to anybody, family or friends.
Okay, the fact is you can open up, though. You can, at least on some level. Maybe it's superficial, talk about yourself, right?
Yeah.
Okay.
But you're ahead of the game because you're self-aware. So knowing that, it may take you several sessions to get comfortable with a treating professional. Have a little compassion for self and trust that perhaps the atmosphere will lend itself for, as you've experimented with friends and other colleagues to open up eventually. And the therapist should help you open up too.
Yeah, go ahead.
I guess the issue is, I just see it as a hierarchy. Them above me and me below them, with them in the position that I'm the one that's seeking help. Is that a wrong perspective to look at it? Should I, try to look at it a different way? I just feel like,
That's a good point, Eric. I can describe some things to you about the therapy relationship, about the therapist, that might encourage you to feel. The only thing I'll say a few things. The only thing a therapist has over you is the knowledge and tools to help you. They're not any better than you. They're not any worse than you. Okay?
I agree, but it's still hard to,
Okay.
to trust them. But
okay, let me finish. The therapist has to come across as a human being and be able to listen to you. Otherwise, they're not worth their salt. So if you go in, it might take a while, but eventually you'll feel that this other person is a human being. He's not here to examine you, evaluate you, judge you. He just wants to listen to what you have to say. Often a lot of patients come in, they're afraid that their therapist is going to judge them, criticize them. They feel so awful, and they think that, that they've done terrible things. The thing about seeing a therapist who has postgraduate training, they have been in therapy themselves, and that's what we're advocating. People who've gone through what you're going to go through, and they also, when I started treatment, I didn't trust my therapist. I had the same feelings. I had to finish a good psychotherapy, psychoanalysis. So did Lana before we were certified to treat other people. So I know just about every experience you might have because I went through it myself.
In other words, we know what it is to feel vulnerable, and we won't judge you for feeling the vulnerability because we felt it ourselves. And perhaps sitting in a session with you, if you're feeling vulnerable and not able yet to address it, it might rub off on the therapist. The only difference is the therapist is aware of it, and perhaps you're just initially uncomfortable with it.
Any person who hasn't had their own, and that's one of the questions you ask. Have you had postgraduate training? So somebody may say, yeah, they got their graduate degree, then they're going to say they took a couple of courses, postgraduate. That's not postgraduate training. You want to know they've had postgraduate training in psychotherapy, psychoanalytic psychotherapy, psychoanalysis, and they completed the training. They completed it.
And they know what it is like to be a patient themselves. It's
exactly.
Very important.
If they say a lot of people drop out because they can't take the pain of going through it. I was going through hell, and Lana went through hell to get there. So we were willing to make that sacrifice. Sure.
That's the trait that one should stay away from, that they see inside of their therapist in order to, get the most out of the experience. You mentioned that, they should be willing to listen to you and, have to be open, but is there certain characteristics that one they stand clear of dealing with these therapists who are, intent to help us?
Anyone that doesn't talk to you should be avoided.
Okay.
That's one. Two, anyone that doesn't ask you to say more about what you're asking instead of and saying, oh, I know what you're talking about. Nobody knows what you're talking about until your story. You see, everybody has a story.
Yeah.
And your reason you're going to therapy, it's very simple. A lot of people don't appreciate this, that you want to know what your story is. It's like writing a book. And he's going to help you write your story from the beginning chapter to the end. And he's going to ask questions. And
it's an emotional story. The mind is 93% underground. I can recall going for a second treatment because the first treatment for me, I wasn't ready for it, and the therapist wasn't adequately trained. And the person that I was interviewing said to me, "Please tell me your story." And my answer to that was, if I knew my story, I wouldn't be seeking help from you. And I left the interview pretty early. I didn't know my story, and I knew enough about myself that I wanted somebody that could help me get to my story.
Okay, this has helped out a lot. Thank you very much.
you're welcome. Okay, so we're talking about how to find a qualified professional. You want someone, I guess I should say, MDs don't have training in psychotherapy. They have training in medication. They do their internship in a hospital, psychiatric ward, prescribing medication to very psychiatrically severe patients. The run-of-the-mill personality disorders, neuroses, depressive disorders, anxiety, are outside of the psychiatric hospital. So they don't get exposure, experience, or supervision with that. And I said psychologists can work in a college setting, doing an internship, counseling, doing short-term counseling, and finish their internship with a licensed PhD or PsyD and hang it out in the suburbs and start treating people. They haven't had 1 ounce of personal therapy. They haven't had the coursework. We've had to take 25 courses, 350 hours of supervision, a minimum of 350 hours of personal analysis. It's awesome. So you want a therapist that's going to be on time for your sessions, is going to close your sessions when they're supposed to be closed, who's going to charge you a reasonable fee, who's not going to talk too much and is not going to talk too little. Can you think of anything else?
Someone that eventually you'll consider, as was discussed earlier, a human being, somebody that you don't feel that is sitting in the sky as a god and trying to judge you. If you can relate to the therapist on an emotional level at all, it is a good indication. And would not, I don't know, I don't believe in a lot of therapists that are on managed care panels. A lot of angry therapists are on managed care panels. They work for half their fee and they spend the rest of the time with a lot of paperwork. I would seek private psychotherapy and talk to a therapist about a reduced fee. A lot of therapists have open hours and they're willing to see you perhaps at a lower cost depending on your income and circumstances.
Okay, yeah, so there are public places you can go to, community mental health centers, where you can use your Medicaid card or Medicare, or their fees are on a sliding scale. It's cheaper, but as I said, I worked in an outpatient mental health clinic. Quality of training, I have to be honest, is not good. I couldn't fire everybody that was there, but I surely felt that I would like to let some people go and bring some new people in who were really well trained.
There are a lot of clinics that are attached to training institutes in the 5 boroughs, mainly in Manhattan. Our email will be on the screen. If you have any questions or want to write us, we're open to that. Feel free to do so.
Yeah, I was going to talk about that. There are psychotherapy institutes, psychoanalytic institutes. This is postgraduate training that Lana and I had. These institutes have a clinic where they accept patients and they do treatment with these the students do treatment with these patients. And the students are on different levels, beginning, middle, and advanced. And someone makes, a person comes into the clinic, will pay maybe a low fee, like $35, or even $10 if this is...
Not anymore.
Not anymore if they're going into a special research study.
Maybe, but not $10.
When they're required
anymore.
to be in treatment 10 days, 4 days a week. Some people get a break like that. Karen Hornoy has that.
But it'll be based on income, and you'll get qualified help because the person that you'd be seeing is required to be in psychotherapy themselves.
And they're taking coursework and they're under supervision. Even though they're students, they're doing everything we did to be an effective therapist. And they're really dedicated to doing what they're doing because they want they want to do in-depth treatment and appropriate treatment. So there are, I think, 22 analytic institutes in New York City. You can look at it in the yellow pages, that's fine. You can look under analytic institutes, there's no names of anyone. Each institute has a different orientation. And if you don't like it, go someplace else. You should do at least 3 consultations. And a lot of practitioners don't charge you if you don't select them. Let's say you've done 3 consultations. One person might say to you, if you decide to see me for treatment, then I'll charge you for the session. But since you're just shopping, I'm not going to charge you. Some people will charge you. Different strokes.
And bear in mind, too, if you have health insurance, which now has been a federal legislation that's recently passed, mental health treatment is on par with physical treatment. And an employer having 50 employees, I believe it is the law, must offer benefits. If you do have health insurance, for example, is I don't accept insurance, but what I do is give you a paid invoice for my consulting services, and then you're free to send that to your health insurance company. And normally payment is usually 50% up to about 30 sessions a year.
Okay, so going back, you can directly ask your practitioner if they have postgraduate training, completed postgraduate training in psychotherapy, and you want to see the certificate. It should be hanging on the wall. Lana and I both have certificates that are hanging on the walls of our office. You know, practitioners, no different than other people. They lie. They want business. I'll be honest with you.
Don't accept anybody saying to you with that question, why are you asking? That's a way to defer and to deflect that back to you, and don't accept that from any treating professional.
You just say, I've heard that the best kind of people have this kind of training, completed the training, and have been in practice for a number of years. So you can see the date they completed training on their certificate. The certificate is by the Board of Regents of the state of New York. It's certified. And how many years they've been practicing. Hopefully they have malpractice insurance. Some don't. It's expensive. All right, selecting a treating person. We covered some of that already, but
it's overlap.
How did you select your person? You remember?
Actually, for the second time that I went through the process, I do remember it was, I was in a dark mood at the time. The world looked kind of bleak to me. And out of the 3 people that I interviewed,
you had a therapy before that.
I suggested I took the bleakest person in the group.
Most depressed.
I was right at home. I found my original family with the therapist. That was part of the process. But I trusted since I had been in the process before, I trusted my gut reactions to the person. The other interviewer wanted to know about my story, and that wasn't a successful interview. And the third person was rather intellectual and heavy, and I liked more to be with somebody that was human, that could express some emotions during the session. So while the dark person didn't express any emotions, at least he was able to listen to mine.
Selecting it, you know, a little backdrop on this. By the time you're at that point, you're really very vulnerable and you're scared, and you're not really, maybe not thinking very clearly, and you need to discriminate who you see. I recall I was dating someone who saw that I had some problems, and I was starting out as a scientist, not a clinician, in experimental psychology. I have a master's in experimental psych, and she suggested I see a therapist. Her therapist, she wasn't seeing him anymore, and that was a really lousy experience. At one point he said he took me as far as he could go, but the real truth was he couldn't deal with me, and gave me 3 names of other therapists to consult with. No therapist should tell you that he's taken you as far as he's going, and if he does, he should explain it, which he didn't do. So I did 3 consultations, and one guy, a PhD, gave me the wrong. The first one was a doctor, a psychologist, certified psychologist. The one I said dismissed me. The one I went to consult with was also a PhD. He gave me the wrong floor number. He's located, and I asked him about it. He got defensive. He said he gave me the right one. I said, no, you didn't. I wrote it down. You know, you're going to get shit like that. They're human beings. They're crazy, a lot of them. You know, very often patients are healthier than their therapist. They're more social, they're more active, they're more creative. They do more things, they go on vacations. I'll leave that alone.
In line with that, I offer a service in my consultation arm of my practice, and it was helpful to me to be sent by a professional shopping. So if somebody doesn't want to see me, or can't afford my fees, or has a bad chemical reaction to me, I do what is called send one shopping. You can report back to me, and I charge you for the session, and I will help you determine who to pick out of the 2 or 3 possible names on the sheet. And sometimes that's helpful, because sometimes running it by an objective ear, you might wind up hearing something that could benefit you and help you decide which person that your gut tells you to see.
So I eventually went to see a woman who I was impressed with, who helped me greatly. And what I didn't know is that she was struggling with cancer from smoking. She didn't tell her patients, and she died, and the patients were left hanging up in the air. Didn't tell her patients for economic reasons. You know,
It's very sad.
there are no princes or princesses out there. You know, these are down and out human beings with the same motives, moods, drives that we have. You have to be careful. This is why we're doing this. Okay, beginning the process. You're good with this.
Now I'm terrible with beginning the process. Have some trust, even if you don't feel like you do, and you might be being evaluated by your therapist, but also take the time to evaluate for yourself how the therapist feels to you. And you're going to be experienced a therapist over a period of months in two different ways. You'll be feeling the therapist as somebody from your past, hopefully, that you didn't like. And as much as you can tell that therapist how much you don't like him or her would only benefit you in the long run.
Well, you may fall in love with them.
Or eventually, but that's not for a year or two.
No,
it's
no,
more
you
like
could
a
have
4-year plan.
You could have a honeymoon the first year.
Yeah, it's true. You could like the therapist too much. I presently have a client that likes me a little bit too much.
The first year is a honeymoon.
Yeah,
Go
but you
ahead.
could also hate the therapist. But note the feelings. Anything that is experienced by you very intensely, we call it overdetermined. If it's felt a lot and overwhelming to you, remember that it's something that you've experienced before and it's past related. It's not just the therapist. It's a pretty good barometer. So have some patience in the beginning, and remember you're testing the therapist just as much as the therapist is testing you to see if you'll remain and click as a patient. The other side of that is the working alliance between you and the therapist. Again, have some patience and see if you're overreacting to something, having a lot of intense reactions behaviorally, then it's what we call you're acting out. So you might not be able to tell the therapist in words, what you just said pissed me off, but you might be demonstrating in the session some hostility. So if the therapist points that out to you, don't necessarily run to the door. See if you can explore that and talk with the therapist about what just happened.
Okay, I knew you would talk about the positive parts of
What's
starting
the
the
negative?
process.
We'll leave
Now
the
I'm going to
negative
talk
to
about
you.
the negative. Negative. Negative is you think you had problems when you started therapy?
Just wait.
Just wait. It gets worse before it gets better. That's universal. And you start saying, why did I come here? I'm having more intense feelings. I'm seeing a chiropractor because I got neck pain, head pain, diarrhea.
Can't sleep at night.
Can't sleep at night, palpitations. My wife or my girlfriend is jealous of, she wants to know what I say to my therapist, especially about her. So you got to deal with that. Or your mother or your father want to know. Or they're blaming themselves that you went to see a therapist. And so they're confessing and saying, feeling guilty about it. So it really gets bad. And I remember saying to my therapist, you know, I have more problems now than I had when I came in here. But what it does is it brings up and turns up the volume on which you don't have the volume turned up. You turn the volume down because you don't want to hear or feel the fear or the pain or the ugliness. And the therapist turns the volume up. He has to, so you can hear what's going on. And a good therapist will be supportive and maybe laugh a little bit. You know, he's got to have a sense of humor, a very good sense of humor. When you say, you know, this is getting worse, when I started, money, it's going to take dollars, sometimes many dollars, to have a good therapy, to have a good therapist, which means you're going to have to sacrifice. It has to be your priority. It's your life. You've got to make everything else secondary. I did that, Lana did that. You know, cars and boats and babies and houses and vacations.
Don't make any major decisions for the first 2 years in therapy.
Freud
You're wasting your time.
Absolutely. Freud said, do not make any major decisions in your life in terms of work, in terms of love. I remember treating, when I was at the clinic, treating a Taiwanese young lady who after 2 months told me she wouldn't be in the next 2 weeks because she was getting married in Thailand. And I said, you know, there's a principle that, and I haven't mentioned it to you, that people should really refrain or hold off on any major decisions in their life, you know, until they really get to know themselves really much better, much better, who they are. That's what I mean. Because if you don't know who you are, you're making bad choices. Because you make choices based on what you need and who you are in life. That applies to relationships, it applies to work. So what does she say to me? I don't want her to get married. I mean, she fought with me. I wasn't saying that, and she couldn't understand it. It was 2 months into the therapy. I couldn't say, stop, don't do it. All I could say is, it's my recommendation. The patient is free to do whatever they want to do. They want to sabotage themselves, fine. You know, I can't do anything about it. All right, so money is an issue, and it's your life. It's just like your physical life. Do you want to spend the rest of your life humiliating yourself? How many people really have a lot of regrets in their life and don't do anything about it in their 60s, 70s? They're still the same. They haven't changed.
And most people talk about later. They'll change their work later. Well, they rationalize everybody is into a 9-to-5 job. It's only the wealthy and the creative that can either work for themselves or have more meaningful work. That's not true. What's true is that your personality is blocked by a lot of what I call old laundry. The child basically by the age of 3 has integrated the personality of the parents. You're really not yourself until you explore who you really are. Some people are lucky and they do what they want to do and like to do, and they find it pretty easy, but most of us are pretty neurotic and get stuck in life at different points in our life. Basically, people repeat the same story of their childhood over and over again for their lifetime, unless a therapy would stop it.
Yeah, you can't blame it on your parents anymore. It's your baby. And you either sink or swim with it. They did the best they could. They had good intentions, hopefully, but that doesn't cut it. So, again, there's a huge sacrifice, especially, again, with cost, because frequency is very important when you're in therapy. Once a week is like putting bandage on an open heart surgery, open heart operation. Twice a week, it's good to start. 3 times a week minimum. Because what happens is, the minute you walk out the door, today especially, you've got noises pounding you, pressures, job, family, girlfriends, boyfriends. There's a lot of noise outside, and that noise interferes with you being able to hear what's going on inside of you. Even if the volume's turned up, the noise outside overwhelms and displaces whatever you might be feeling inside, whatever you might be thinking. And those things inside are the most important. It's not the external world anymore. If you can't really focus on your internal world, you're not a good candidate for therapy. You're really not. And maybe something else will work for you.
Or maybe you're just not ready. There are a lot of people that experiment with therapy in their 20s and 30s, and maybe they become more ready when they're in 40s. In other words, what Russell was saying earlier, when their back is against the wall, then they look at therapy. I don't think we have time to talk about how to evaluate the process.
Did we talk about establishing an alliance?
I did minimally on the positive end.
You want to say more about it? Yeah, I want to throw this back to Kirk. Eric, I'm sorry. Establishing an alliance. You really need to begin to see your therapist as wanting to help you, sincere, genuine, helpful. You're more able to trust them. You respect them.
But at the same time, you need to balance all the adverse reactions that you're feeling about the therapist. That his pants aren't buckled right, that his hairdo is too long. I mean, all these overdetermined reactions are probably something from your own past. You need to walk in therapy with a balancing act, having your feelings on one sleeve and having your heart and head with beginning to trust on the other sleeve. And it's a balance.
Forget about the externals. The therapist is overweight. His clothes are from, the 70s. His office is a mess. He seems, like he's not organized, he's got papers all over the place. You can use all that stuff to say, distance yourself. Say, he's not for me. I don't like him. But that says nothing about the therapist. It doesn't tell you anything about his ability to help you. So you can play that trick too. And that alliance is very important. Once you have that therapeutic alliance, then the work begins. That's after the honeymoon. And that's after the back and forth, negative, positive, ambivalent feelings you have towards your therapist, and they get interpreted.
But keep talking about them anyway. Don't hold anything back.
Okay, we're running the credits, so we got 3 minutes. What do you want to say about evaluating your therapy?
You may be in a stalemate. You might have to call me. Look at my website. Are you too long in the same therapy? Do you have a lot of insight without any behavior change? Do you frequent power struggles with your therapist? Too
Yeah.
many different therapies? Never experienced the good enough therapy? What is it? Check out my website, lanaakaway.com.
There's some patients who've had 3 or 4 therapies, and you wonder what happened, you know, and you ask them about it, and they're not clear. They just didn't like the person. Well, they had a power struggle with the person. They didn't want the therapist to get the best of them. They wanted to be superior. They talked down to the therapist. They criticized the therapist. That happens a lot. We take a lot of abuse, and we have to allow it, and a lot of madness that we have to allow. We have to let the patient ventilate whatever feelings they have towards us and the world. There's no cure unless that can be done. So you have to be a pretty strong person, and you can't get personally involved. You can't take anything the patient says personally. You can, you know, you hear it and feel it, but don't react to it. You have enough self-worth as a therapist and trust in your abilities and skills and knowledge and faith in the process that you don't fall into this trap. And that's the difference that's something you have to look out for if your therapist gets defensive or testy. Okay. Look, I hope that we've shared something important with you. And I think we didn't receive a lot of calls about this because a lot of people are, I think, somewhat threatened by this subject. And what do you think?
Yeah, I think too, in this instance, silent is not particularly golden. I think we probably blew a few people out of the water, but you can think about it and
okay.
Email.
If it shakes you up,
Good.
it's good. You're not dead. Thank you. You can also write to me on my email,